Hi, my name is Kale Evans. I am a nursing student here at Wilson State College, and today I will be performing a pediatric assessment. So, before I enter my patient's room, I'm going to knock, enter, provide privacy, closing the door. I'm going to do hand hygiene, and I'll introduce myself to the patient and the parent or guardian that is with them. So, hi, my name's Kale. I'm the nurse that's going to be taking care of you here today. I'm going to ask you a couple questions before we get started. So, hi there, what's your name? Johnny. How old are you, Johnny? 10 years old? Well, you're getting pretty big. And you are Debbie, okay, and your relationship to Johnny here, you're his mother, okay. Could you just verify his last name for me? Thank you. And his date of birth? Perfect. Alright, so when I walk in, I'm just going to start assessing general appearance and making sure that his respiratory is not labored or anything, making sure he's not in the tripod position, or he's not showing any objective or subjective signs of pain. I'm going to make sure that he's holding a good conversation and he's conscious with both me and his mother. To build rapport with the patient, I'll be asking various questions and having conversation related to the patient's age. So since he's 10, I'll be asking questions about school, asking him if he likes his teacher, what kind of class is his favorite, what he does at recess, what he likes to do outside of school, just to make sure that he gets comfortable with the setting and with me as well. And so once all that's done, I can then start asking if there's any medications that he's taking, if he has any allergies. If he can tell me, that would be perfect. And then if he isn't sure, I can go to the parent. So I'm going to ask for allergies, medications, any over-the-counters, any prescriptions, any vitamins that he might be taking. If there's any past medical history, if he's diabetic or anything, if he has epilepsy, if he has high or low blood pressure, and then family history, any past surgeries. Once all that's covered, I can go back to the physical assessment, and I can ask if Johnny could walk across the room to the scale. So, Johnny, do you think you could walk to the scale over there for me? You can? Perfect. So, as he's walking over there, I'm going to assess for his gait. I'm going to make sure it's strong. He doesn't have any weaknesses on either side. I'll get his height and weight over there, and I will make sure to have it wrote down in kilograms and meters, but I'll also convert it into pounds and inches for the mother so that they get a better understanding of his growth. I'll make sure to chart it on a growth chart and to assess that. If this was a younger child, younger than 2, I'd make sure to do the head circumference as well, which is just across the eyebrows, around the midline, into the back, and also plot that on their growth chart. So once that's been done, I can then go back to the patient and have him sit down. I'll have him sit up in the bed, and I'll just explain to him how I will be doing a respiratory assessment. So I'd make sure, if he was unsure about the procedure, I'd just let him play with my stethoscope. I'd explain to him what it does. So this is my stethoscope. I'm just going to use it to listen to you. All I'm going to do is just put these in my ears and put this to your back, and I'll have you breathe normally for me. And if he was still unsure, I'd let him use it either on mom or me, or even on himself, just to get him more comfortable. So once he's comfortable, I can then just have him sit up for me in bed, and I would just listen to the lung sounds of the upper and lower lobes bilaterally going back and forth, making sure that everything's sounding good and equal to the upper and lower lobes, both bilaterally. And then I'll do the same on the front, so both bilaterally on the upper and lower lobes, making sure everything's sounding great. Doing it in all the the different positions. After that, I'll make sure to count the respiration rate, make sure he's not in any respiratory distress. Excuse me. At this time, I can take the patient's pulse ox and explain to him what it does. It's just a little red light that's going to clip onto your finger, and it's just going to measure the amount of oxygen in your system, in your blood. And so I'll clip that on, and I get a reading of 99% oxygen, and then it also tells me his pulse is 70, which is normal. So I'll take that out, and then I'll go on to checking his heart rate. Excuse me. And so to check his heart rate, I will then listen to his apical pulse, which is just off midline, and I'd listen to it for a full minute, full 60 seconds, and that does meet with what my pulse ox said, so that's good. I would then also check radial pulses, making sure that matches up as well. Next, I would explain that I'm just going to listen to his stomach, look at it, make sure it's all going good. So I'll just pull that down and pull up his gown. And so I'm going to look for any discoloration. So he's got a nice pink stomach. There's no cyanosis, there's no pallor, he's not diaphoretic or anything like that. And so I'll take a look first, and then I'll listen in the 4 quadrants and making sure that there are active bowel sounds in all 4 quadrants. And then lastly, I can palpate lightly, making sure that there's no pain. So once that's all done, I can also make sure to, when I was asking for pain there, I can also ask the patient if they're in any generalized pain throughout the body. This can be asked towards the beginning of the assessment. So he stated that he's not having any pain right now. If the patient were having pain, I would have them, I would explain how the FACES pain assessment tool works, and I'd have them rate their pain from 0 to 10. So after that, and after the stomach, I can then go on to the patient's extremities, just making sure to check for any edema or anything like that. So there's no it's not pallor, it's not cyanotic, there's no edema up here. I can check the radial pulses again, making sure they're equal and bilateral. And then I can also check the nail beds, making sure that the cap refill time is less than 2 seconds on both of them. So that's good. And then I'll do the same thing for the patient's legs. So I'm just going to make sure that the temperature is good. They're not hot, they're not cold. There's no edema, pitting or non-pitting. I would make sure to check the pedal pulses, which they are equal and bilateral and normal. And then I would also check the cap refill time of the toes, which are both less than 2 seconds as well in both. So those are bilateral, and just making sure that the nail beds are pink and not cyanotic. There's no clubbing present in either, in any of the fingers. So once that's done, I can then make sure to check the mucous membranes of the child, so the ears, the nose, the mouth, making sure there's no secretions coming out. If there is, I would make sure to take note of them and their description for further charting, and possibly if the provider is going to want some sort of test from it, if he wanted like a strep throat test or something like that, I would make sure that the patient's ears were normal, they're not red or anything. I'd ask the parent if they had been pulling on their ears or anything to show that there's any pain. The patient can verbalize that they're not having any pain. anywhere in their ears or their throat. I'd make sure that there's no nasal flaring of any sort. So I'd make sure that I have his pulse, I have his pulse ox reading. I can then go on to make sure that I can get his blood pressure. So I'd make sure to get the blood pressure cuff that is 2/3 the circumference of the patient's arm, making sure that the pediatric cuff fits. And when I take his blood pressure, it is 110/90, which is fine for his age. After that, so I have his blood pressure, I have his pulse, I have his pulse ox. Next, I'll use the thermometer to take his temperature. I will explain that he's probably used to the oral thermometer that goes under his tongue. I'll explain that this is a tympanic one, so it's going to go into his ear. So all I'm going to do is pull your ear up and back and then insert it, press the button, and it'll tell me what your temperature is. So if he is unsure about that, I can demonstrate it on mom, or he can try and do it on mom or me as well. And so I'll do that, pull the pin up and back, hit the button. So the patient is 98.6, so that's good. And his respiration rate is 20, which is normal for his age as well. So after that, if this patient was staying long term, I could take more of in the genitalia region check. If there's no concerns from the patient or from the parent telling me if they don't have any concerns, then that can be looked over. If this patient was an infant, we can look because they're in diapers. But if there was more of a reason to look, we could do it at a more adequate time, which is like during a bath or something. If there was any specialty things that the patient might have, like a stoma or a nasogastric tube or something, I would make sure to take note of that. If they had a nasal cannula, I'd make sure to reposition, make sure that there's no swelling or inflammation or reddening or irritation from them. Make sure that they're all feeling good and not in any pain whatsoever. So once I've finished with that, I can then wrap up my assessment with the child. I can ask the parent if they have any questions. I ask the patient if they have any questions as well, making sure that there's no further concerns that they want me to look into. After all that is done, I'll make sure that they're feeling good. I'll have the bed in the lowest position, I'll have the side rails up, the call button will be within reach of the parent, and then I can leave the room performing hand hygiene, leaving the room, and going to document my findings.